This session we will be discussing quality management. The objectives of this session are to explain how quality improvement affects the patient and the organization. We will apply quality management principles to clinical situations, and we will discuss the value and importance of conducting an environmental assessment. Let's look at this case study. A significant increase in patient falls resulting in injury has been reported on your unit. In accordance with the National Patient Safety Goals, you are assigned to a multidisciplinary quality improvement risk management team to address the problem. Steps in the risk management process include defining the high-risk situation, which in this case is the patient fall. Determine the frequency of the falls, intervene and investigate, and identify opportunities to improve care using the steps of the QI, or quality improvement process. Let's look further at the steps of the quality improvement process. First is identifying the needs, which includes compliance with the National Patient Safety Goals, reduction of hospital risk or financial loss, reduction in length of stay or after an adverse fall event, and improved patient outcomes. The next step is assembling the multidisciplinary team, which consists of nurses, physicians, unlicensed assistive personnel, pharmacists, facility environmental management representation, QI, and risk management experts. Data collection is the third step in this process. This data will include, but is not limited to, defining the incidence of the fall, determining high-risk patients, age, mental status, history of falls, medication, physical environment, and the final steps in the process are to select and implement the plan and evaluate the plan. The steps for outcomes and indicators require education of 100% of all direct care providers, completion of fall risk assessment on 100% of patients, reduction in patient falls by 25% within 3 months of the program, medical record demonstrating 100% compliance with the fall prevention program, and establishment of a prevention plan. This plan will include consistent use of identification bracelets based on the fall risk assessment score, implementation of bed alarms, staff education. For example, you'll want to toilet at-risk patients routinely, and change of the environment like vertical grab bars. Evaluation of the quality management process would be change in incidence of falls, for example, through incident reports or root cause analysis. Staff compliance with the fall prevention plan, patient family satisfaction with the plan, and reliability and validity of the fall risk assessment tool to ensure reliable tools are being used. Standards of care for fall prevention are implemented through different methods. These standards can come from the Nurse Practice Act, professional organization guidelines, institutional guidelines, for example, policies and procedures, or structure and process standards, research evidence-based practice guidelines, and accreditation standards, such as the Joint Commission National Patient Safety Goals. The National Patient Safety Goals include patient identification, communication among caregivers, incidents controlling high-risk medications, infusion pumps, risk of healthcare-associated infections, use of accurate medications across the continuum, and patient falls. Risk management as it relates to malpractice relates to duty, dereliction, damage, and direct cause. Duty, the nurse, we know, has the responsibility to the patient. Dereliction means the nurse did not carry out the duty. Damage means the patient was injured. Direct cause means injury secondary to the nurse's failure to carry out the duties.